Hello, everyone. Today we are going to be talking about a condition called Graves' disease. So, what is Graves' disease? It is an autoimmune disease, which means a person's immune system attacks its own tissues, which in this case is the thyroid gland. This attack causes the thyroid gland to produce an excessive amount of the thyroid hormone, which results in an enlarged thyroid or hyperthyroidism. While it can affect anyone, Graves' disease mainly affects women, ranging from the ages of 30 to 60 years old. Graves' disease can be inherited if a family has a history of autoimmune diseases. The chance of getting Graves' disease is much higher in this case. Finally, this disease takes its name from a man who first described it clinically, Robert James Graves. He made this discovery back in the year 1835.
The exact cause of Graves' disease is still unknown. It is an autoimmune disorder where the immune system causes the thyroid gland to become overreactive. Factors such as stress, infections, or genetics may trigger the disease.
Here are the symptoms that you might be experiencing if you have Graves' disease. First of all, we will talk about the first common signs. Number one, feeling stressed and annoyed from the simplest things. Number two, having a light tremor in your hands and in your fingers. Number three, increased sensitivity and intolerance to heat, and you'll be excessively sweating. Number four, losing weight in spite of an increased appetite. You will be eating properly, but you will still be losing weight. Number five, your neck will be swollen due to the enlargement of the thyroid glands. Number six, you will experience low energy throughout your day. And other signs that you might also be going through is irregular menstrual cycles, not being able to keep an erection during your intercourse, often bowel movements, you might hear it or you might feel it, bulging eyes, also known as the thyroid eyes, which your eyes will be popping out a bit. You might feel irregular heartbeats, you might have disturbed sleep, and you will feel a thick discolored skin at the top of your feet.
Diagnosis of Graves' disease is done through several methods, including physical exams, lab tests, and imaging tests. Doctors usually start by looking for signs like an enlarged thyroid gland, rapid heart rate, weight loss, and bulging eyes. The condition is mainly confirmed through a blood test. People with Graves' disease usually have high levels of thyroid hormones T3 and T4, and very low levels of thyroid stimulating hormone or TSH. Another marker, called thyroid stimulating immunoglobulin or TSI, can also confirm the autoimmune nature of the disease. Finally, a radioactive iodine uptake scan is used to see how much iodine the thyroid absorbs. In Graves' disease, iodine uptake is increased throughout the gland, which helps doctors tell it apart from other types of hyperthyroidism.
Treatments for Graves' disease focuses on reducing thyroid hormone production and controlling its symptoms. The most common treatment is radioactive iodine therapy, which destroys thyroid cells to shrink the gland. However, it may worsen thyroid eye disease and requires a lifelong hormone replacement. Secondly, anti-thyroid medications block thyroid hormone production but could bring about side effects such as liver damage or low white blood cells. It's often short-term or for pre-surgical use. Thirdly, beta blockers are one of the most safest options for immediate symptom relief as they focus on symptom control and not hormone reduction. They often relieve rapid heartbeat and tremors. Fourthly, total thyroidectomy is a definitive and permanent treatment as it removes the entire thyroid gland. It requires lifelong hormone therapy and carries low risks of damaging the vocal cord nerves or parathyroid. Lastly, thyroid eye disease treatments include lubricating drops, surgery, steroids, or radiotherapy.
Conclusion: it's an autoimmune disorder that causes the thyroid gland to overproduce hormones, disrupting the body's normal functions. Its exact cause is unknown, but factors like infections, hormonal changes, and genetics may play a role. Early symptoms such as weight loss, tremors, and bulging eyes are key for timely diagnosis. While there is no cure, treatment like medication, radioactive iodine, and surgery can effectively manage the condition and improve quality of life. Ongoing research offers hope for better